In this video, I'm going to go over exactly how I treat ADHD. Of course, like usual, we'll be using rating scales to track progress over time and to improve outcomes. But besides that, what medications can we use to treat ADHD? Well, there are two main classes of ADHD medication. There's the stimulants, like Ritalin, Adderall, and Vyvanse. You've probably heard of those. And then on the other side, there's the non-stimulants like Qelbree, atomoxetine, guanfacine, clonidine, and Wellbutrin. Let's start with the stimulant medications first. Within the stimulant medications, there are two broad categories. There's amphetamine type medications and there's methylphenidate type medications. On the amphetamine type side of medications, there are four main types that we can choose from. There's mixed amphetamine salts, which is probably better known as the formulation Adderall or Mattias, and those have 75% dextroamphetamine and 25% levoamphetamine. There's amphetamine formulation, which has 50% dextroamphetamine and 50% levoamphetamine. A brand name for this is Evykio. There's just dextroamphetamine, and these might be better known as Zenzetti or Dexedrine. And there's Vyvanse, also known as lisdexamphetamine, which is a prodrug, which means as your body metabolizes it, more and more of the drug is released, so it's a very smooth release mechanism. Now over on the methylphenidate side, we have three main different compounds. There's methylphenidate, and there's immediate release formulations and extended release. Immediate release formulation known as Ritalin, extended release formulation known as Concerta. There's dexmethylphenidate, which is known as Focalin, and it has both immediate and extended release formulations as well. And there's a newer medication known as Astari's brand name, and the generic is sir-dexmethylphenidate, which is also a prodrug, kind of like Vyvanse. Usually, stimulant medications are first-line options for ADHD. They have a very high effect size, which means most of the time they work very well. But stimulant medications are controlled by the government because there is a small potential for addiction. So that's something to consider and keep in mind. Sometimes people don't tolerate the side effects of stimulant medications, or they don't want to risk the side effect of potential for addiction. And so they would rather consider non-stimulant medications. There are a few different classes of non-stimulant medications. There are three main ones. The first class are norepinephrine reuptake inhibitors, like atomoxetine and the brand name Qelbree. The second class of non-stimulants are blood pressure medicines, and two of those are guanfacine and clonidine. Both clonidine and guanfacine are alpha-2 agonists postsynaptically, and that results in increased norepinephrine in the prefrontal cortex. And lastly, there is bupropion, which is a norepinephrine and a weak dopamine reuptake inhibitor, so it increases both of those. Of course, some patients don't wish to start any medication, and they would rather try something more natural, like a nutraceutical. Some of the nutraceuticals that can be considered include ginkgo biloba, magnesium, which may help more with sleep and anxiety, but may in turn help with attention and focus if you're having way too much anxiety or having sleeping problems. Saffron, which has some studies to support its use, and phosphatidylserine might also be an option as well. A big difference between the stimulant medication and the non-stimulant medications are, of course, that the stimulant medications, there's a potential for addiction, but also a main difference is that the non-stimulants have to be taken every day for them to work consistently, whereas the stimulant medications have a bit more flexibility. You should take them every day if you want to perform well and have your ADHD symptoms controlled. However, the stimulant medications don't need to be taken every day for them to work. If you take a few days off and then you take the stimulant medication like Adderall, it will still work. Whereas the non-stimulants like atomoxetine, if you take several days off, you'll probably have to titrate back up in the dose. Now, some of the common side effects to look out for when starting stimulant medication or non-stimulant medication would be decreased appetite and dry mouth are probably the biggest ones, but they're usually not too concerning. You can drink more water and find different times of the day to eat. Two other side effects are trouble with sleep and nausea. And of course, these medications can possibly make anxiety worse. However, I have noticed when anxiety stems a lot from ADHD symptoms and not being able to get the work done that you know you need to get done, then when the ADHD is treated, I've noticed that the anxiety oftentimes gets better. That being said, sometimes the anxiety is from the ADHD symptoms, and sometimes anxiety is uncontrolled and doesn't get better with ADHD treatment. So head over to this video next to find out exactly how I treat anxiety.